Good morning and welcome to Live at the Legislature, where every week we talk to your state representatives about what's happening at the state capitol. Like many news and talk programs, we are now virtual, limiting the person-to-person contact we have for social distancing and to limit the spread of the COVID-19. Today, we're lucky to have House Majority Leader Della Belatti as our guest. Della, good morning.
Good morning, James, and good morning to the Olelo staff for putting this together so quickly.
Yes, it's really great of them to do this. With the 2020 legislature in suspension right now, what are the representatives up to? What are they doing?
We have been extremely busy. I know that representatives are fielding phone calls. They're on Facebook talking to constituents. They're helping to connect the community, sewing masks, making sure that kids get fed, kupuna are talked to. There's lots going on.
Well, everyone, of course, is very concerned about the coronavirus here in Hawaii and across the country. And yesterday there was a House Select Committee on Economic and Financial Preparedness that you are a member of. What happened during that committee? Can you tell us?
So that was the second meeting of that committee, James. And it's really important because what the House has done is convened a group of industry, community leaders, along with representatives to begin to lay the foundation and the framework for recovery. We know we are in it for the long haul. We understand that we still have to deal with the public health crisis. But as everyone has experienced in the community, we have seen so many layoffs, disruptions in the normal life and normal economy of our state. So what we're beginning to do in the House is really identify what the framework is going to be, how we move forward. We're going to be identifying short and long-term plans, and we're going to be monitoring the situation. Things are developing on such a rapid basis that we want to make sure that community members and industry leaders and government are working together and in sync.
Yes, it is. It's changing every day. Well, when is the third meeting and what is the topic of discussion for that meeting?
So the next meeting will be next Monday, 10 a.m. We are just like this program, using Zoom and other kind of platforms to make sure that it can be publicly broadcast. The House is very concerned that we want to make sure that our operations are transparent. But in this day and age of now social distancing, we have to adapt, and that's what we're doing. In terms of agenda, we're going to, I think, be looking at different sectors. Yesterday's meeting, we kind of focused on the social safety net. My hope is that we're going to be taking up different topics. I know people are very concerned out there about health insurance, so we might be looking into that. There's so much to do. And in addition, we have such great resources. Our chairperson, Peter Ho with Bank of Hawaii, and our other co-chair, Speaker Saiki, are really helping to develop the agenda. I will also like to add that, members of the House are weighing in. Like I said, they're working behind the scenes, connecting community, but we also have members who are tracking down questions, interacting where it's appropriate. We have to give the executive department and agencies room to do the immediate work that they need to do. But we are already starting to look down the road. What is the different kinds of policy questions that we're going to have to answer? We're going to want to prevent a pandemic like this from disrupting our community again in the future. What are we going to need to do to lay the groundwork to ensure that we can recover from this as well as make our community more resilient?
Wow, that's an ambitious agenda. Most of the committees we see on TV, where we're seeing press conferences and committee hearings all the time, but this one is very different than the others because it's not focused just on health, but the recovery effort. Who are these committee members? How are they qualified to talk on this subject and lead us into the future of the economy after this is gone?
So that's a great question. When the House set up this committee and when Speaker Saiki selected the members of the committee, we were really looking for the community leaders in all sectors. So not only do we have the financial sector, but we have the nonprofits represented on the committee with Lisa Maruyama. We have members from all the different chambers of commerce. We just added, I believe, the Kona Chamber of Commerce. Speaker Saiki has that discretion to do that. I will also say that we had the community there through folks like Micah Kane, who was also just added to the committee recently. He heads a Hawaii Community Foundation. And you know what, James? It's really going to be a partnership. we're going to need, and we're already seeing the public and the private community step up. We're really proud that Mike Akane and HCF has taken the lead and started the Hawaii Resiliency Fund. That is going to be so critical because in some ways what we learned, as Representative Nakamura said at yesterday's meeting, what we learned from the Kauai flood instance is that sometimes government cannot be as nimble. So that's when the private community steps in with the private donations. And we're seeing that. It's so amazing. All over our community, we are seeing individual members, organizations, nonprofits step up, and we're doing it. I'm proud that we're following really tenets of aloha. There's a great community organization out there, Islander Institute, that has started this hashtag spread aloha, not COVID. There's lots that we can do. Government will be there. We are there. We're preparing as soon as we are called back into session. And that's something that Senate President and Speaker will be able to do. I don't anticipate that it's going to happen soon because of the stay-at-home work orders that we have from the governor. But when we are called back into session, the legislature and the House will be ready.
Wow. Yeah, we are different than other places. I've seen other communities that support each other, but we do have aloha in Hawaii, and it's great to see. How can residents stay in touch with their representatives during this time when we're not at the Capitol?
That's another good question. So the Capitol is closed, but the legislature is still working. You can continue to contact your representatives at their phones at the Capitol. You can also contact them by email. Just go to capitol.hawaii.gov, and then you can pull up our legislators and their contact information. But the other way to really stay connected is that so many of the House members are on Facebook. So if you're on Facebook, get on. It's been a good way to stay connected. There's Instagram. There's all kinds of ways to stay connected. And, if you're not the Facebook kind of person, call your representatives, send in your email. I know a lot of representatives are also doing email blasts to their communities. So, you have to get connected to your representative, and they are definitely a trusted source for information that you can call, email, direct message, text, all kinds of ways to get in touch with representatives.
And when do you think the legislative session might resume? Do we have any clue at this point, or what's it look like?
I cannot predict that. I think we really are, as a community, still in the place where we are looking at the health aspects of this. So that's going to be a determination. I love what on the national level, Dr. Fauci is saying. The virus is going to determine the timeline. We are preparing. I want to give a shout out to General Hara and the executive team on all the islands that are looking for alternative care sites, that are working day in and day out with our hospital association. They really are preparing for that peak. We don't want to see it, but we do want to anticipate that there are going to be people who will really need serious care in the hospitals, and we're preparing for that time. I think the stay-at-home orders, people stay at home, stay healthy, stay safe, is so important, because if we can stop the virus from spreading, when those people who are going to be sick get really acute and need the help that they need, they will get that. When that is over, when we are able to beat that, that's when I think we'll be able to come back into session. But that is going to be the call of the Senate President and the House Speaker.
Okay, I think we're out of time, but as always, it's been a pleasure talking to you, and we'll be back again next week with another edition of Live at the Legislature.
Aloha, thank you.
doing? We have to go. I'm gonna be late for work.
It's Tuesday morning. I gotta record live at the legislature on Alelo. Senate and House leadership discussing what's happening at the state capitol.
So just watch it on the news tonight. Come on, let's go.
Hey, this is like getting the news before it's news. If only I could get this remote to work.
There. Can we go now?
No DVR? No problem. Watch Wednesday evenings at 7 p.m. on Channel 49.
Okay, aloha, and thank you for joining us on this very special edition and Live at the Legislature. We're coming to you live Tuesday morning, March 31st. For those of you watching the TV feed live right now, we're having some technical difficulties with the video, so we appreciate your patience. But I'm told that the audio is coming across fine, so hopefully we'll be able to get information that we need to you. Thanks for bearing with us as we adjust, as all of you are adjusting to this unprecedented situation. Our guest this week, we have the President of the State Senate, Senator Ron Kouchi, coming to us live from his apartment in downtown Honolulu, where he's been on self-isolation for the last 14 days. Senate President, thank you for joining us.
Thank you, Jesse. Well, it's 12 of 14 so far.
Okay.
And we've had the special committee of the Senate meeting on COVID-19. For today at 1 o'clock, we've got General Hara, who will be coming to address the panel. At 2 o'clock, Dennis Ling, the administrator for the Department of Business, Economic Development, and Tourism. At 2:30, we have, Dennis is at 1:30. At 2 o'clock is Jane Sawyer. She's the U.S. Small Business Administrator. So she's at 2 o'clock. And at 2:30, we have Riker Wada from Human Resources Development. We've been broadcasting and trying to get as much information out to the public, and then certainly for the members of the legislature, an ability for us to stay on top of the policies as they evolve. I just received an email while Della was doing the House portion from General Hara, and they do have a draft form of the Neighbor Island travel. And so they're going to ask you for your traveler name, your resident address, contact telephone, home and cell, the destination, so your airline, your flight number, hotel lodging or destination address, purpose of visit, duration of the visit, number in the party, a signature line, and a date. And unfortunately, when the governor held a press conference yesterday, he said that they are going to be issuing, or he will be signing, a new declaration. He has not signed it yet. So for those who have been calling about what those essential definitions would be and the rules, they were still working on it. Hopefully by 1 o'clock this afternoon, General Hara will be able to get us some better information as far as what that looks like. Another call I got while waiting to go on was from some in the building trades industry. Mayor Kawakami has a much more restrictive policy on what essential construction is compared to the other counties. They were asking, who should we follow? Well, it's clear that the governor has a broad state policy, but each of the mayors in their respective counties can have policies that are more restrictive than the general guidelines. They cannot adopt a policy. As an example, they couldn't say you don't have to quarantine, but they can say we think that these are essential. They can be more restrictive. So in the case of Mayor Kawakami, unless it's essential government infrastructure or affordable housing, he has pretty much said, we're not going to let other construction occur.
So Mayor Kawakami was one of the first county mayors to put in these strict restrictions, and you were an outspoken supporter because you really want to help us flatten the curve of this COVID-19 outbreak.
Yes, and then clearly being, in self-isolation, I've been watching CNN day and night, as well as reading a lot of material. And it's clear that, the self-isolation or staying at home, minimizing our movements is the best thing that we can do to combat the spread of COVID-19. Clearly, Mayor Kawakami took a bold step, but he did what is now shown as the right thing. I believe the next place we're going to be going is wearing masks. And again, I want to be clear, for the most part, the mask does not protect you from catching the disease, but the mask prevents you from spreading the disease. And we are now finding that there are asymptomatic persons who are in fact infected. And so, this is an important aspect. They believe that that's why some of the Asian countries have gotten better numbers. Testing has become more available. It will help us succeed. And then circulating in social media spots. And if you go to the Hawaii News Now website, they did a piece with Dr. Carl Kim from the Natural Disaster Institute at the University of Hawaii. They have a quick questionnaire that they would like you to fill out, and that would help in the contact tracing. I filled it out. It was very quick. The other thing that I did, and one of the strongest things that we can do to ensure our recovery when we hopefully return to normal, is to fill out the 2020 census. Make sure that we get all of the money that would be coming to us. If you have access to the internet, all you have to do is go to My Census 2020. It'll come up. When I did it, it was like 3 to 5 minutes, very quick to complete. But let's not leave the federal dollars on the table that we will so badly need when we get into the recovery period.
And the reason you're pushing for that is because that's what the federal government uses to determine how many people we have on the state and therefore how much money we deserve. So everybody who signs up for the census gets more federal money for Hawaii, which we're going to critically need for this recovery period. Now, we're running a little short on time, but I know you've been in self-isolation for 12 days. You look like you're doing good. How are you feeling? And have you talked to Senator Nishihara and the other senators?
Well, Senator Nishihara is doing well, and as Representative Belatti had said, we are in touch by text message. Senator Kahele, Senator Keokaloli have regular Facebook Live programs. I joked with Senator Keokaloli, he's my new favorite program at 7 p.m. Former Council Chair Mel Raposo has set up a couple of Zoom Facebook Lives that I've participated on. And with various committees, we're using the technology to stay in touch. Everybody's busy working and trying to do our best to communicate with our constituents, get the best information out there. But again, the best information is limit your movement.
Well, thank you so much for welcoming us into your home and experimenting with us while we do this new virtual Live at the Legislature, which we're going to keep doing for the time being as we help to flatten the curve and prevent the spread of coronavirus. So we really appreciate you taking the time to join us this morning, Senate President, and we're going to keep doing this every Tuesday morning. And this replays Wednesdays at 7 p.m. on Olelo and on all the neighbor islands, including Ho'ike. Thanks to everyone on Kauai who's watching us right now, and thanks, Senate President, for joining us.
Aloha.
Aloha.
What are you doing? We have to go. I'm gonna be late for work.
It's Tuesday morning. I gotta record live at the legislature on Lelo. Senate and House leadership discussing what's happening at the state capitol.
So just watch it on the news tonight. Come on, let's go.
Hey, this is like getting the news before it's news. If only I could get this remote to work.
There. Can we go now?
No DVR? No problem. Watch Wednesday evenings at 7 p.m. on Channel 49.
Aloha and welcome back to Live at the Legislature, our first remote broadcast. My name is Ka'eo Kealoha-Lindsay for the Legislative Minority, coming to you from my bedroom in Kaimuki. And joining us this morning is Representative Gene Ward. He is the Minority Leader and Representative from House District 17. Looks like in his home in Hawaii. Representative Ward, good morning.
Good morning. Wait, time out, Ka'eo. I want you to know you can hear me, but hey, my visual aid is for 2 points. One is my wife finally convinced the CDC that this is recommended. And secondly, she doesn't let me go anywhere without this. So in a way, in fact, here's the serious bottom line point of that. People who have asymptomatic are infecting others naively and unknowingly. So the CDC has probably seen the data that, hey, if you are infected, you then don't spread it to somebody else, because so many of these things are happening, which, why is New York half of our cases? I mean, okay, they're very large in numbers and they're very touchy-feely, but I think it's because people are not wearing masks and those who are infected don't actually realize what they're doing. So anyways, for my wife and CDC, here's the salute to the mask for the day.
So going on to that point, well, we'll kind of compare what's going on on the continent versus here. I think our total deaths have surpassed China in the U.S., but in Hawaii we're still, hovering above the 200 cases for now. So what's your assessment so far of what's been going on? And I know it's been a couple of weeks since we've been on live last.
First, kudos to Della Belatti. I gave a great report, and I think the committee that she is on, that Speaker Psyche is doing, is really doing a great benefit. I listened in yesterday when the guy from Matson said, hey, by the way, we are on schedule, we are normal, don't worry about any disruptions, don't have any difficulties. And to me, that was very reassuring, and I tweeted that out, and it in effect became a good message for the people of Hawaii. We still got toilet paper hoarders out there. We still got people think you're not going to get enough of this, enough of that. Well, I think we're going to go back to normal shortly, because they even said that they have more vessels they could put online into the sea with supplies if to. So anyways, that was really a good note. But in terms of where we are, Ka'eo, maybe I should also be thankful for Olelo doing what we're doing, keeping as business as usual. And we are open for business. I even put my jacket on in my living room this morning, because this is coming from live Ha'ione Valley, my office east. And we are doing as much as possible. As you know, we have our staff meeting every day. We have our monthly newsletter. Even our beer summit is going to have Mufi Hanneman this Thursday. We're going to do it virtually. In fact, I've probably never talked more on the phone than I have now through the beautiful video conferencing that Zoom offers. It's really quite amazing. In fact, anybody who's listening who hasn't used it, for what the price is, $14 a month, you can do up to 100 people. And it's really, really crystal clear, almost as clear as Olelo's technology here. But in terms of where we are and where we're going, I want to give some good economic news. America has an economy of about $22 trillion. The money that's coming out of the Congress is $2.2 trillion. That's 10%. 10% of your economy, if it stalls, is now being filled up. So I think people should know that aid is on its way. Those who have missed their jobs or on sick leave, they're going to be taken care of. There's a lot of safety nets. There's huge operational costs that are going to be met for businesses. And I think we're going to get through this storm, as the indication is probably by, at least my numbers, which I crunch every morning, probably by mid-May, we're going to see some light at the end of the tunnel. And by June, we should be able to actually look, we're out of the woods. But again, that's just my interpretation of the numbers. But in terms of what's going on in terms of good health news, Kyle, the numbers say 95% of the 610,000 cases in the world, 95% of those are mild. I mean, that's really good news. 95% are mild, which goes back to what I said earlier. Some people don't know that they have it, and they're spreading it around. I think those are the real culprits. The U.S. has 141,000 cases, but we have 1.7% of those who mucky. In other words, the death rate is probably one of the lowest in the world. So that is really good news. Mild symptoms and relief is on the way. The bad news is, and my theory is, it's unless we get those asymptomatic people taken care of with masks, we're probably going to see continual spikes in some areas, particularly those who are not paying attention to what's going on. And locally, finally, in terms of the good news number-wise, we have 204 cases today. But only 7 to date, I repeat, only 7 people have required hospitalization. 7 out of that number is only a few percentage points, which means we have a really good hospital capacity for beds and for respirators and for being well adjusted to what's going on. I understand that we've run short of time, so I don't have to talk about, we don't need to let prisoners out. We can probably isolate them in the best way as possible. But let me put it this way. Relief is on the way, and the light is on the hopefully mid-May tunnel, and that if we continue speaking with the public, as Della said earlier, being available by phone, being available by our websites, by social media, we are at business as usual, and you know, as we prepare our monthly newsletter, we get feedback, and we're doing constituent services now more than ever. We're basically a communication network. Lastly, I want to thank the doctors and the nurses. These have been the first responders to our health. These have been the first responders who really give us hope that, hey, a lot of these things are being treated, and so many people come out mild without really any infections. The one downside of that is there's still suspicion that there's those who come out of symptoms and they don't have any more positive tests, they still may have some shedding of the virus. That is kind of still a mystery. So I would say to the good Senate President, President Kouchi, when you get out, stay away for another 8 days just to make sure that nobody gets any of that again, because we don't want any of that around here. And the last good piece of news about Hawaii is we have no one who's actually died. And thank God that's the case. Thank God we got the internet. Thank God we've got doctors, and we've got Alelo and Yukaio to keep the public informed. That's my report for my first live from Hahione Valley.
Absolutely. It's like you said, Rapport, definitely a cause for patient optimism. There is light at the end of the tunnel, but we'll continue to encourage folks at home to continue the social distancing, practice their sanitary.
They have to hunker down. They got to know what flight they're on. They're not going to Hilo saying, "Are we there yet?" They're going to go all the way around the world, and they got to be patient, not hold their breath, but be patient and pace themselves. And probably if you got kids at home, don't expect them to actually go back to school, is my prediction.
Excellent, excellent. Representative Ward, thank you for joining us this morning, and thank you again to the Olelo team for organizing this all together very quickly, and thanks again to the House and Senate majorities for their segments as well. We will see you next week. Aloha and have a great week.
Thank you, and aloha.